So really to talk about what you need to do when you start a cash practice, it's very different than insurance practice. You really need to change your mentality, because with insurance practice, you can basically, you can have bad bedside manner. You basically getting your patients from insurance, from the insurance company. It's a high volume. You don't really have to care about the patient that much. When you switch over to cash, that patient is key. You really need to focus on the patient, because the patient's paying cash, so they'll go elsewhere if they feel uncomfortable. You're not an expert. The staff isn't perfect. Staff's a little, you go to a typical medical office, staff doesn't care, they're kind of nasty. You can't have that in a cash practice. So really need to change the focus. You need to be passionate. It takes a lot more effort to be a cash practice, and that you need to become a better physician. With insurance medicine, most doctors, nice studies out of Journal Medical Association and New England Journal of Medicine, most doctors are practicing 10 to 20 years behind what's available in the medical literature. And it takes a proven new therapy, on average 17 years to become accepted in mainstream medicine. They said, why is that? So they looked and they said, well, one reason is doctors don't read medical journals. They don't. And you say, oh yeah, we do. There's so much information coming out. How can you read all those journals? But they found a bigger reason is why these new therapies are not accepted, is that if you give a doctor 100 studies, 10 studies, 100 studies showing what they were doing is wrong, they don't want to hear it. Oh no, my patients are fine. They just mentally say, I don't have the time to do this. And we'll have doctors call. We'll basically get a patient better. They've been seeing their primary care for 10 years, no better, send them back, better. I thought they'd be happy. No, they're mad. They don't like it. Oh, don't tell me what I'm doing is wrong. So, and they keep doing this is basically the same thing, because that's, they try to keep their head above water. Anything that slows them down, if something takes 10 minutes more, forget it. They're not going to adopt it. So with cash, you really want to, what do you focus on? You want to focus on therapies that insurance people aren't doing. So there's a group in our area, they're called independent doctors. They're trying to go to cash, but they're doing the same thing as insurance doctors. So why should a patient come to you if they can get the same service elsewhere for insurance? So we'll talk about just a little bit of background. Again, we'll talk about insurance medicine, how to become a successful cash practice. We'll talk about training. We'll talk about marketing, of course, requiring for that, call center, how important that is, and ways to increase revenue. A key is you really want to find ways for residual income and not rely on just patient visits, because otherwise you're going to have to be there all the time to keep, basically to build your practice. So just a little quick background. Founded the Holtorf Medical Group 10 years ago. We started as a cash practice. I told doctor buddies were, oh, you're crazy. There's no way you can't make it, and it worked because we were doing something different. We do integrative and innovative treatments. Always looking for new treatments. We would do definitely age-related hormone deficiencies, of course, bioidentical hormones, complex endocrine dysfunction, thyroid dysfunction, huge. So many people are fatigued, and thyroid is a great treatment for those patients. Fibromyalgia, chronic fatigue syndrome, no one's treating those very well. Infectious diseases, age management medicine. And I think the power of really, with a cash practice too, if you can kind of bring all the different specialties under one roof, that is key. Because the way medicine now, insurance medicine is, okay, you have your endocrinologist, you have your gastroenterologist, you have your infectious disease, and neurologists, they all have to go and they're all fragmented. I'm telling you, you can do research for a couple months and with the right training be better than that specialist, whatever field it may be, and treat patients better. To say it really holds true is that if you have a hormone problem, don't go to an endocrinologist. If you have a chronic infection, don't go to an infectious disease doctor, because they just keep doing what they've been told for 20 years. Current revenue is about $9 million a year. We have 4 doctors and 2 nurse practitioners in our office in Torrance. We opened our first affiliate model in Foster City in 2008, had a second doctor 11 months later, and currently have Pasadena and Philadelphia affiliate centers. Founded the Fibromyalgia Fatigue Centers 2003. We opened up 12 centers across the country, all cash from the get-go. Board examiner, board certified here. Spoke a lot about bioidentical hormones. I also have talked at kind of standard specialty societies, and also kind of with being a cash practice and kind of doing different things. One thing you have to do is support your therapies. And one thing when a patient comes in, you need to sell that patient that they are in the right place, you are the best doctor for them. Because what's going to happen? You're going to tell them something different than their doctor, and so they're going to have to decide what's better. So how do you do that? Well, you have to explain to the patient why you believe this and why that doctor believes that. You need to do better testing to convince the patient. For instance, with thyroid, comes in, the TSH is normal. They say, my doctor says my thyroid's fine. We say it's not. Well, what are they going to believe? When they go back to their doctor, who's going to freak out because they're on thyroid. Well, you show them, basically on paper, free T3 reverse T3 ratio is low. You can do thyroflex and show that their tissue level's low. We check everyone's basal metabolic rate, that's low. Sex hormone binding globulin correlates with tissue levels. So you explain all these things to the patient. And you just have, 5 tests that show you're low, but this is why your doctor also says you're not. So now you give them thyroid, they feel better, and that doctor goes, you shouldn't be taking thyroid. Screw you, I feel a lot better. I'm just losing weight now, my depression's gone, my antidepressants, I don't need those anymore. So an educated patient is your best friend.